G'day, I'm Brad from Men's Health Down Under, and just a very quick video on how you would manage a prolonged erection. Prolonged erection, otherwise known as priapism, by definition is an erection which persists beyond 4 hours. Now 4 hours of having your penis erect after you've done an injection, and it can happen after you've taken a Viagra or one of those tablets, but that's pretty uncommon. Typically it occurs when you've done an injection and the dose was too much for your body. Now that could occur at a low dose for some guys, and for some guys it could occur at a really big dose. So we don't know what dose that might occur at, which is why your doctor or nurse or pharmacist or whoever's talking to you about this stuff would generally advocate for starting on a really low dose to make sure that it doesn't cause any problems, and then gradually increasing that dose up to the desired result occurs. So what we would typically find is that an erection which is firm enough for penetration, which I would roughly define as 75 to 85% erect, is going to last about 45 minutes to an hour and a quarter. Now, if we make the penis more erect than, say, 85%, it's going to last for longer. Certainly if you made the penis 100% of a normal erection, it is going to be prolonged. It is going to last more than a few hours, and at that point in time it's going to become uncomfortable. So be conservative with your doses and just go up gradually. There's no rush to get to the maximum dose or the effective dose. We want to make sure you're comfortable. So that is the primary those are primary importance. Now, if for some reason you happen to get a prolonged erection or even a painful erection, there's a few things you can do that you need to be aware of to help it subside. One of the things we tend to give our patients here at the clinic is a card like this, which is a card on managing a prolonged or painful erection. Now, it says on there what you're to do. On the other side of the card, it's got a spot for you to write your details on. That might sound a bit peculiar, but the reality is, if you've done the things on this card which I'm about to go through and it still hasn't subsided, then you're going to have to go to the local emergency department. It can be quite painful and it can be embarrassing to turn up to the local emergency department. So the idea is on the reverse side of the card is write your details on it, and it basically says, I'm presenting under the instruction of my pharmacist or urologist as I'm currently experiencing a prolonged erectional priapism. And when you give that to the nurse at the triage desk, they will prioritise you as the top priority, and hopefully you'll be in and out pretty quickly, and that erection will be calmed down. There's a lot you can do before you get to that point though. So step number one, get your pseudoephedrine. So the pseudoephedrine is your sinus tablets, so the ones behind the counter at the chemist that you need to show your license for and explain why you're using them, and the other medications you're taking. Have them on hand. Don't wait until you've done the erection, find out that it's prolonged, and then try and get them. Have them ready to go. So you want them at home, and if they go out of date, that's a great result to have. So pick them up at the local chemist, make sure you've got them ready to go. You take a couple of those, you can chew them up if you want, that might make them work a little bit quicker, but it's quite fine just to swallow them down whole, so 2 of those. If you're on a whole heap of other medications, or other medications generally, just make sure that the pharmacist is okay with the medication you're taking. Some medications can interact with these pseudoephedrine tablets, and you want to make sure that you're not going to cause yourself any harm by taking them. So double check that with the chemist or your doctor, make sure that they're safe. So that's your pseudoephedrine tablets, 2 of them, and then you could repeat that if needed. That would generally be on the advice of whoever's provided them to you. So I'd normally say to the guys, if it hasn't subsided within an hour and you've taken your pseudoephedrine tablets and done the other stuff we're about to talk about, after an hour then you could repeat the dose, and if it's still not working, off to the emergency department. So 2 pseudoephedrine tablets. The second thing to do is have a cold shower and or apply an ice pack. Now you know what it's like when you go to the pool and it's cold, everything contracts and shrinks, and that's exactly what we're trying to do. We're trying to get everything to constrict, contract, pull back, and by doing the cold shower and the ice pack, we can shrink those blood vessels, take some of the pain away as well, because it's often quite uncomfortable, and get the blood out of the penis. So that's another nice easy thing you can do at home, and you don't have to wait until it's painful or prolonged. You know, you might have had intercourse and just think, oh, I know it's prolonged, it's not going away quickly enough. You can do that straight away. Equally, you can do that with the pseudoephedrine as well. So don't feel you need to wait 2 hours or 3 hours before you enact this management for priapism. The third thing to do is pump the legs. If you've got a little flight of stairs at home, go outside and get your legs pumping. Up and down, up and down, up and down, up and down those steps. What that's going to do is it's going to move the blood into your legs because you need the blood in your legs to make those muscles work, and by doing that it's going to pull the blood, hopefully, out of the penis. So they're the three things we tend to recommend the guys do. So 1, a couple of pseudoephedrine tablets. 2, cold shower and an ice pack to calm it down. 3, get out and move your legs, pump, pump, pump. Flight of stairs is fine. If you haven't got a flight of stairs, a brisk walk up and down, the driveway or something similar, is equally effective. Of course, if those measures aren't working within an hour, I'd generally say to the guys, go into the emergency department or repeat the pseudoephedrine, perhaps, and head into the emergency department and explain to them what's going on, and rest assured they'll treat you with respect and provide you with plenty of dignity and get that sorted out for you. So that's the management of a prolonged erection, particularly after having used one of the intracavernosal injections for erectile dysfunction, or the management of rehabilitation for guys that have had prostate cancer. Hope it's been helpful. If you've got any questions, don't hesitate to get in touch via the socials down below or menshealthdownunder.com.au. Thanks so much.